Good day everyone, I am Shaina Salibel. For today, I am going to discuss the procedure about cardiopulmonary resuscitation for infants. But first, let's define what is CPR. CPR stands for cardiopulmonary resuscitation. It is a life-saving procedure that is done when a baby's breathing or heartbeat has stopped. This may happen after drowning, suffocation, choking, or other injuries. CPR involves rescue breathing which provides oxygen to the lungs. Normally, CPR for infants age is 1 to 0 years of age. In addition, there is a common acronym in basic life-saving that is used to guide providers in the appropriate steps to assess and treat patients in respiratory and cardiac distress. This is CABD: circulation, airway, breathing, defibrillate. So here is the example of scenario. An infant is found lying on the ground. For the assessment, assess to make sure the scene is safe for you to respond to the downed patient. Second, assess unresponsiveness. Like for example, lightly shake or tap the infant's foot and say their name. Look at the chest and torso or trunk for movement and normal breathing. If the infant is unresponsive, if you are alone and collapse is unwitnessed or you can witness what happened, first perform 2 minutes of CPR, then call the emergency response team and bring an automated external defibrillator to the patient. And if you are alone and collapse is witnessed, the first thing you will do is call the emergency response team and bring an automated external defibrillator, then start CPR. If 2 providers have someone near, call the emergency response team and bring the automated external defibrillator and you start CPR. Take note, place patient in supine position and in a hard flat surface. Circulation. Feel for either the brachial or femoral pulse. Take note, do not check for more than 10 seconds. If the infant has pulse, move to the airway and rescue breathing portion of the algorithm. Give 12 to 20 breaths per minute. Recheck the pulse every 2 minutes. If the infant doesn't have a pulse, begin 5 cycles of CPR. It lasts approximately 2 minutes. Start with chest compressions. Provide 100 to 120 compressions per minute. This is 30 compressions every 15 to 18 seconds. If you are the only one provider, place your 2 fingers on the sternum of the lower chest. One between the nipple line and the other one is 1 cm below. But if the providers are 2, encircle the infant's torso or trunk with both hands with both thumbs, pointing cephalic position 1 cm below the nipples over the sternum. Chest compression should be at least 1.5 inches or 1/3 the depth of infant's chest. Press hard and fast. Allow for full chest recoil. Only allow minimal interruptions to the chest compressions. Take note, if 1 provider, 1 cycle is 30 chest compressions to 2 rescue breaths. If 2 providers, 1 cycle is 15 chest compressions to 2 rescue breaths. If you have 2 providers, switch roles between compressor and rescue breather every 2 minutes or 5 cycles of CPR. Let's proceed to airway. In the event of unwitnessed collapse, drowning or trauma, use the jaw thrust maneuver. This maneuver is used when cervical spine injury cannot be ruled out. The first thing that you are going to do is place your thumbs on the upper cheekbones of the infant. Second, place your finger on the lower ramming of the jaw. And lastly, provide anterior pressure to advance the jaw forward. In the event of a witness collapse, and there is no reason to assume C-spine injury, use the head tilt chin lift maneuver. First, place your palm on the patient's forehead and apply pressure to tilt the head backward. Second, place the fingers of your other hand under the mental protuberance of the chin and pull the chin forward and cephalic. Let's move to breathing. Scan the patient's chest and torso for possible movement during the assess and responsiveness portion of the algorithm. Watch for abnormal breathing or gasping. If the infant has adequate breathing, continue to assess and maintain a patent airway and place the infant in the infant recovery position. Only use the recovery position if it is unlikely to worsen patient injury. If the infant is not breathing or is inadequately breathing, if the infant has a pulse, commence rescue breaths immediately. If the infant doesn't have a pulse, begin CPR. Go to circulation portion of the algorithm. Use a barrier device if available. Make a seal using your mouth over the mouth and nose of the patient. Each rescue breath should be small and last approximately 1 second. Watch for chest rise. And lastly, allow time for the air to expel from the patient. During normal CPR with an advanced airway, provide 12 to 20 rescue breaths per minute. Take note, do not stop chest compressions for rescue breaths. If the patient has a pulse and no CPR is required, provide 12 to 20 rescue breaths per minute. And recheck pulse every 2 minutes. Recovery position for infants. Cradle the infant with the infant's head tilted downward and slightly to the side to avoid choking or aspiration. Continually check the infant's breathing, pulse, and temperature. Defibrillators are devices that restore a normal heartbeat by sending an electric pulse or shock to the heart. They are used to prevent or correct an arrhythmia, a heartbeat that is uneven or that is too slow or too fast. Defibrillators can also restore the heart's beating if the heart suddenly stops. Arrival of automated external defibrillator. For the power, turn AED on now. Early defibrillation is the single most important therapy for survival or cardiac arrest. Begin use on patient as soon as it arrives. Follow verbal AED prompts. For the attachment, firmly place appropriate pads, adult or pediatric, to patient's skin to the indicated locations or pad image. Analyze. A short pause in CPR is required to allow the AED to analyze the rhythm. If the rhythm is not shockable, initiate 5 cycles of CPR. Recheck the rhythm at the end of the 5 cycles of CPR. If shock is indicated, assure no one is touching the patient or in mutual contact of a good conductor of electricity by yelling clear, I'm clear, you're clear prior to delivering a shock. Press the shock button when the providers are clear of the patients. Resume 5 cycles of CPR. Manual defibrillators are preferred for infant use. If the manual defibrillator is not available, the next best option is an AED with a pediatric attenuator. An AED without a pediatric attenuator can also be used.
Advanced cardiac life support.
Advanced airway interventions such as supraglottic airway or SGA, placement of endotracheal intubation or ETI may improve ventilation, reduce the risk of aspiration, and enable uninterrupted compression delivery. Airway placement may interrupt the delivery of compressions or result in malpositioned device. Advanced airway placement requires specialized equipment and skilled providers, and it may be difficult for professionals who do not routinely intubate children.